Unacceptable medical neglect. Georgia Department of Corrections, GDC, is recklessly jeopardizing the life of an individual battling stage 4 cancer. Shockingly, chemotherapy treatment was abruptly halted at just 19 days out of 40. Attempts to extract information from GDC and WellPath, the medical provider, have been met with evasion and silence. We demand answers. This is a blatant violation of human rights, and we won't tolerate it. Share this post far and wide to expose the injustice and demand immediate action. The life of this individual hangs in the balance, and GDC's negligence cannot go unchallenged. Share, amplify, and let the world know that we won't back down until justice is served. Man fighting stage 4 cancer in Georgia Department of Corrections. Johnson State Prison. James Slater is fighting for his life within Department of Corrections. He has been fighting for months for adequate medical treatment, and the state and the medical personnel are just playing around with his care. According to the Georgia Department of Corrections Standard Operating Procedures and Policy, it states that offenders in the custody of the Georgia Department of Corrections, GDC, will receive the full range of treatment services necessary to meet contemporary standards in the community. Additional services will be provided as necessary to identify medical problems that might deteriorate as a result of the correctional environment or that might be hazardous to other offenders or staff. The ultimate decision regarding standard of care rests with the GDC statewide medical director. This policy is applicable to all facilities that house GDC offenders, to include private and county prisons. Policy name, Scope of Treatment Services Policy Number, 507.04.07, effective date October 14, 2022. With this being said, why do adults in custody, AIC, have to fight so hard for the care that they are seeking? This isn't only hard on the AIC, but it is also hard on the family on the outside, as they are trying to do what they can to help their loved one. GDC also charged the AICs to be able to go to medical. Under GDC policy, charges to offender accounts for healthcare provide in policy number 507.04.05 says each offender will be charged a fee of $5 for requesting medical treatment except for services deemed necessary by the facility, visit related to chronic care, or medical emergencies. Each offender will be charged a fee of $5 for each copay eligible medication. How is this acceptable? In this case with Mr. Slater, he would fall under chronic illness. The definition of this in GDC policy is any condition that requires periodic monitoring and treatment in order to prevent deterioration of health, minimize pain, and maintain activities of daily living. In addition to the common diseases monitored in the chronic illness clinics, hypertension, cancer, diabetes, pulmonary, seizure disorders, HIV and TB infection, this may also include diseases such as hepatitis C, rheumatoid arthritis and other autoimmune disorders, renal disease, etc., Crohn's disease, joint disorders from an inflammatory process or trauma with objective data, X-ray evidence, etc. Policy number 507.04.05 Part 3.d. If this is a policy for GDC, why is Mr. Slater not being sent out or getting the care that he needs to help him with his cancer? I have made calls to WellPath, who oversees the medical within GDC, but have yet to hear back from them. Even though you are in the care of the state, you should be getting adequate medical attention. If they allow Mr. Slater to keep going this way, he will pass away due to GDC and WellPath not taking his health into consideration. There have been 3 motions that have been filed on behalf of Mr. Slater, one for compassionate care release, one to suspend the original sentence, and one to place him on house arrest. These motions were filed through TNT Legal Services. It is said that the judge denied all 3 of these motions, stating that Mr. Slater did not go through the right channels of pardon and parole. Another group with Human and Civil Rights Coalition of Georgia also filed a compassionate care release, with it also being denied.